verified the physician's order for oxygen therapy, and I have gathered all my equipment prior to entering the patient's room. Yes, Mr. Smith? Hello, I'm Charles Brand with the Respiratory Care Department here at the hospital, and your physician has ordered some oxygen therapy for you today, so I'm here to get that started. You'll just bear with me. I'm going to wash my hands and put on my gloves, and thank you for your patience. Okay, may I have your name and date of birth? Excellent. And let me just check your arm vein to verify that. Excellent. Okay. Before we get started, do you have any questions about the oxygen therapy? Okay, great. I want to get a full set of your vitals as well as your breath sounds, just to make sure there are no concerns, okay? I'm going to start with your oxygen level. If I can just have your index finger. Thank you. Okay, that's 94. And I'm going to check your pulse. Very good, that's 70. And I'm going to check your blood pressure. Very good, 120/80. And your respiratory rate is 15, which is very good. And the temperature, just put this under your tongue. Thank you. Great, 98.7. And I'm going to listen to your breath sounds before we get started with the oxygen therapy, so just bear with me. Just a little bit. All right, thank you, sir. Not going to be able to lift him up, so I'm going to do 8, starting at the bottom base. Just take some deep breaths for me. Every time you feel my stethoscope move, just take a breath in and exhale. 1, 2, 3, 4, 5, 6. Very good. And just lay back. I'm going to do your front sounds. 1. Very good. Very good. And last 2, one more breath. And final breath. Excellent. Sounds good. So just bear with me. I'm going to set up the equipment. And just let me know if you have any questions. I'm going to test the equipment, so you may be hearing a little popping sound in just a second. That was it. Everything's looking good. All right, very good. I've started you out at 5 liters of oxygen, which is a good baseline to start out with, and we're going to see how you tolerate it just to make sure there aren't any troubles. And while we're getting started, I'm going to reassess your vitals. So if I can have your finger one more time. Very good. It has come up a little bit to 95, so that's good. And I'm going to take your pulse. Good. Your pulse is about the same, and your respiratory rate is about the same. Good. Your blood pressure is 120/80. And just temperature one more time. Good. 98.7 on your temperature. Very good. So it looks like you're tolerating it pretty well. I'm going to do your breath sounds one more time on the back, starting in the lower quadrant. Every time I move my stethoscope, just take a deep breath in and out. 1, 2, 3, 4, 5, 6. And just lay back comfortably. Good. Good. It sounds good, Mr. Smith. Good. Excellent. So I'm going to take the information today and document your chart outside of the room and make sure that the doctor and the nurse are notified. Is there anything else I could get for you today? Awesome. Well, I think you did really good on this, and I think it's going to help bring up your oxygen levels and help open up your chest so you can breathe a little bit better. If you have any questions going forward, just don't hesitate to let me know. I think everything's going to be much improved by this time tomorrow. I'm going to take off my gloves and wash my hands. As I leave the room, I'm going to document the patient's chart as well as notify the physician and the nurse of the results. Thank you.